CSSD. CSSD. You should write it the full name of the CSSD. CSSD, okay, stand for Central Sterilization Service Department. Now, the Central Sterile Service Department, it is basically situated in the hospital settings, okay? It is situated in the hospital setting. And you can say the function or purpose of this CSSD, if we talked about their purpose is to maintain, okay, sterile equipments, medical equipments, okay, sterility is, you can say, maintained by this department, fine. And also this department is responsible for cleaning of the equipments, cleaning of the medical equipment, as well as the distribution, fine. So the distribution, if we talked about the purpose of this CSD is, first is cleaning, okay, making equipments sterile, as well as the distribution of a sterile product. This is, you can say, a special department in every healthcare setting, okay, and it is necessary. It is necessary because hospital is the, you can say, environment where you see that lots of diseases are coming. Like generally diseases are cured in the hospital, but you know that the half of diseases are, you can say, present in the hospital. In hospital there are different diseased persons are they are, you can say, taking the treatments, fine. So if we not maintain a proper, you can say, the sterility, if we not maintain the proper hygienicity, then it can lead to the so many, you can say, diseases, and that diseases are basically called as the hospital associated infection, also called as hospital acquired infection, also called as the nosocomial infection, and there can be chances for the cross infection, or maybe the iatrogenic infections, fine. So for reducing all these things, there is the one proper, you can say, separate department in every hospital, and that is called as the CSSD, Central Sterilization Service Department. Now let's briefly discuss about the process of sterilization in CSSD. Okay, so make the heading process, and this process is for the sterilization. This process is for the sterilization in the CSD. That how, you can say, things are you can say, achieving the microbial free and free absence, microbial free absence. The first one is we have to clean and decontaminate the used equipment. So first one is the cleaning and decontamination. Fine. So whenever you can say things comes in the CSSD department, the first step is to clean or making them decontaminated. Now you know now that decontamination is achieved through the use of chemicals, okay, disinfectants. Now next thing is preparation for sterilization. Next thing is preparation for sterilization. Preparation for sterilization. Now here we are basically preparing, after cleaning and decontaminating the equipments, we are preparing for sterilization. Means we are deciding the method of sterilization. Like if we see in that there's not all the equipments are heat susceptible. Some are heat labile, okay, some are, you can say, heat sensitive. Fine, heat sensitive, they will easily block. So we have to choose one certain method, okay, we have to choose one certain method, and that is the next step called as the, after preparing for the sterilizations, we have to choose the method of sterilization. So first step is to cleaning and decontamination. The next process is the preparation for sterilization, and third method is choosing the suitable method, okay, for the you can say sterilization. And after the sterilizing the equipment, we not generally we immediately use that equipment, so we have to store the equipment, clean equipment. So the next step is to storage, okay, storage and distribution. Fine. So once again, what is CSSD? Yeah, it's a Central Sterilization Service Department, and it is basically situated where? Yeah, it is in hospital. The main purpose is to cleaning, sterile and distribution. Got the points? Now, what are the process to make the CSSD, you can say, in sterilization? The first one is to cleaning and decontamination. The next thing is preparation for sterilization. Another one is called as the method of sterilization and storage and distribution. Got the point? No problem. So let's recap today's class. What we studied, basically we studied about the disinfectant. What are the disinfectants? Disinfectants are basically a chemical substance by which we are achieving the disinfection. Okay, we are using the, you can say, not totally microbial free ambisens, but desirable ambisens. Fine, the desirable ambisens. And we've seen that this decontamination words are interchangeably used as a reference of the disinfection. Got the points? And we also seen that there are different disinfectant. If we take the example, the prime example is for alcohol based, like the you can say ethanol and isopropyl. Okay, another one is from the halogen family, like the iodine. Okay, another one is the phenol. Okay, and phenol derivatives like the detol, lysozyme, chlorhexidine. Got the points? No problem. And we also discussed that whenever we are using both of any technique, either sterilization or the disinfectants, we are not, you can say, achieving total microbial free ambisens instantly. It takes some time, and that time graph is studied under the kinetics of synthesis. Then at last we discussed about the CSSD. CSSD stands for the Central Sterilization Service Departments. So by this we finished with the lectures of sterilization and disinfections. We will come up with the new lecture series. So thank you for having me. Bye. Have a nice day.
Good.